Welcome to Indian Anatomist, FMGE, NEET, Next 2024, PG exclusive test series. Good day medicos, have you ever seen something like this box before? A snuff box. Snuff is a form of smokeless tobacco, that consists of pulverized, or finely ground tobacco leaves with or without flavoring agents. The substance is sniffed into the nasal cavity. Traditionally, a pinch of snuff is placed on the back of the hand, or pinched between the thumb and index finger, and then, a little sniff, or inhalation is taken.
Okay. So it's just a little pinch at a time.
Just a pinch there in your hand, and that part of your hand is actually called your snuff box.
Here we go. Oh.
And then we have a snuff handkerchief.
Today's MCQ topic from upper limb. The question is, the boundaries of anatomical snuff box includes the following, except. The options are, A. Extensor pollicis longus. B. Extensor pollicis brevis. C. Abductor pollicis longus. And D is, abductor pollicis brevis. Now what is anatomical snuff box? The anatomical snuff box is a triangular-shaped depression that can be found on the dorsolateral aspect of the hand, near the base of the thumb. It is sometimes referred to as the radial fossa of hand. Dear aspirants, don't get confused with the radial fossa at the humerus's lower end. When the thumb is fully extended, in conjunction with slight medial deviation of the wrist, the snuff box is most easily observed. Before going to the rest of the discussion, let we discuss briefly the movement of thumb. There are 5 digits on each hand, but the thumb is unique in both its appearance and the way it functions in comparison to the other digits. The thumb is distinguished anatomically from the hand's other 4 fingers. Movements of thumb are abduction, adduction, extension, flexion, and opposition. Snuff box is a name that was given to this depression in the past, because it was used to hold snuff, which is pulverized tobacco or any dry powdered snuff, before it was inhaled through the nose. Being an anatomical structure, it naturally has boundaries, which are made up, primarily of tendons and carpal bones. They are lateral or anterior boundary, formed by the tendons of abductor pollicis longus, and extensor pollicis brevis. Medial or posterior boundary, by tendon of extensor pollicis longus. Superficial or roof, formed by skin, superficial fascia, containing cephalic vein and superficial branch of radial nerve, and the deep fascia. Finally, deep or floor, formed by structures, from proximal to distal are, styloid process of radius, scaphoid, predominantly, trapezium and base of the first metacarpal bones. The superficial fascia of anatomical snuff box contains the cephalic vein and superficial branch of radial nerve, or simply, the superficial radial nerve. In this anatomical area, the cephalic vein crosses the anatomical snuff box, having just arisen from the dorsal venous arch of hand. Superficial radial nerve passes over the tendons of anatomical snuff box, where it terminates as cutaneous branches, which provide sensory innervation to skin, over the lateral part of dorsum of hand, and dorsal 3½ digits. The proper content of the anatomical snuff box is radial artery. In the snuff box, the radial artery passes deep to the tendons of abductor pollicis longus, extensor pollicis brevis and extensor pollicis longus. In this fossa, radial pulse can be palpated in some individual, by placing 2 fingers on the proximal portion of the anatomical snuff box. The schematic picture showing that the anatomical snuff box is related to lateral wrist joint includes the styloid process of radius and scaphoid bones. At anatomical snuff box, the scaphoid bone is predominant structure. The scaphoid bone takes most of the impact from wrist blows or falling on outstretched hands, that is, push, causing localized discomfort and possibly fracture. Clinical feature of scaphoid fracture is pain and tenderness in the anatomical snuff box. The scaphoid bone has a distinct blood supply from distal to proximal. A scaphoid fracture might impair blood flow to the proximal portion, causing an emergency. Avascular necrosis and arthritis can result from scaphoid revascularization failure. The scaphoid bone has a distinct blood supply from distal to proximal. A scaphoid fracture might impair blood flow to the proximal portion, causing an emergency. Avascular necrosis and arthritis can result from scaphoid revascularization failure. In addition to fractures and tenderness in the anatomical snuff box, there is a possibility that an aneurysm of the radial artery in the snuff box will develop. Surgical intervention is needed to prevent the distal ischemia and nerve compression. Another importance of anatomical snuff box is the common place for radial artery catheterization is forearm at its distal third, but another site to puncture the radial artery is located within the anatomical snuff box. Hemostasis after radial artery catheterization in the anatomical snuff box preserves distal blood flow in the superficial palmar arch, decreasing access artery blockage. This strategy also decreases superfluous compression after access artery ligation. Dear students, hope you understand about the anatomical snuff box. Now, time to see the answer for the MCQ. The appropriate answer is D, abductor pollicis brevis. Because the abductor pollicis brevis is a fusiform muscle, located at the surface of the thenar eminence. This muscle is supplied by recurrent branch of median nerve, whereas the muscles forming anatomical snuff box are supplied by the radial nerve. Dear aspirants, thanks for watching. Subscribe, like, comment and share. Good day.